I'm Dr. Anthony Cave, a Stanford and Harvard-trained anesthesiologist and integrative medicine specialist, and I was shocked to hear about this case of a young woman here in the United States, affluent country, who had an actual successful sinus surgery but went home and passed away that evening. I want you to learn what went wrong so that you can hopefully ask the questions to minimize that risk of it happening to you if you're having surgery, especially if you have the same comorbidities that this young woman had. The case is, in brief, a 38-year-old woman coming in for a septoplasty. She had a BMI over 40, which puts her in the obese category. For her body weight, had reactive airway disease, what we'd call asthma, and obstructive sleep apnea, OSA. What happened before her septoplasty was that her ENT doctors saw her comorbidities and said, you need to get what's called a surgical clearance from your primary care doctor. So the primary care doctor said, oh, actually, you need to get clearance from a cardiologist because of your comorbidities. The cardiologist did a stress test and noted that there was a clean or a normal stress test, but concern for the respiratory status of the patient. And this is where things kind of went off the rails a little bit. It's a very complex case, but if you are someone who has these types of conditions like sleep apnea, maybe a BMI over 30 or over 40 in particular, or you have reactive airway disease like asthma, these all could apply to you if you're having surgery. So I want you to know what you should ask your doctor, because how the case went for this individual is not how I'd want it to go for you. We talked about the cardiologist, that's a heart doctor, their concern. Unfortunately, it did not get sent to any of the other doctors, or seemingly no one acted on it, because the patient went in for surgery at an outpatient surgery center. The anesthesiologist reviewed the patient, looked at their airway, I'm sure listened to their heart and lungs, and said, you're clear for surgery. Gave them the propofol, they went to sleep. Now, I wasn't there, I don't know exactly what medications they used, but presumably the way it was recorded, it was a uneventful intubation and induction of anesthesia, and the patient actually did great. They were discharged home later that afternoon, and they were given generic instructions to be inclined at 45 degrees so that you don't have too much blood rushing to your face where that surgery site is. You want to minimize swelling. You don't want someone to have trouble breathing if they're flat and there's a lot of congestion after having a septoplasty or surgery behind your nose. What happened was that the husband went to check on the patient at around 11 p.m. Patient was doing okay, reclined in the chair. But then when they went to check at 3 a.m. on her, she was not responsive and dusky in color was the report. Husband calls 911. Emergency personnel come to the house. They try to do CPR, but nothing to be had. Unfortunately, like super sad, right? Surgery goes great, but you come home. I mean, this, like, the trauma of the family having to be around that is incredibly crazy, but then also what happened to the patient, needless to say. Autopsy showed a lot of different findings. What's most relevant is coronary atherosclerosis, or what we call coronary artery disease, and pulmonary arteriosclerosis. This is a little bit more unique, and what I suspect, no one knows, what one suspects might have actually led to the cause of death. So what does this mean for you? Well, in this case in particular, what does it teach us that patients need to be aware of asking their doctors? Of course, it's doctors' responsibilities to take care of you, no question, but it's your body and your health at the end of the day, and it behooves you to be able to know what intelligent questions to ask. In this case, that pulmonary arteriosclerosis is what I think may have been the cause of death for this woman at home. She went home breathing and at some point presumably stopped breathing. If someone with pulmonary arteriosclerosis stops breathing, that increases what's called pulmonary hypertension, or the blood pressure within your lungs, which is different than the blood pressure that we measure on the arm, like you normally do. That's what we call systemic blood pressure. This is looking at pulmonary vasculature blood pressure. You really don't measure it, but if it's high in somebody, which is very rare, however, more common in folks with severe sleep apnea and morbid obesity. If that blood pressure in the lungs goes up, sometimes you can never make it go back down, and that can lead to a heart attack. because the heart, specifically the right heart, can't build up enough pressure to bypass that very high pressure in the lungs. There's a lot of complexity in there. We can talk about it at the end if you want, but my point is that there was something that appeared to be brewing in this lady. The cardiologist said something, but no one else in the surgery team seemed to be made aware of the cardiologist's concern. And this is where, number one, you need to always ask your doctor, especially before surgery, hey, I met with my X, Y, and Z doctor. Did you see their note? I had surgery today with someone who saw their cardiologist and there was no note. I had to call a cardiologist before we came in for surgery because I wanted to know exactly what happened. I needed to fish around for that information because life is messy and that note didn't make its way to me before the patient was having surgery. Now, fortunately, nothing bad happened. It was A-okay, but you can see in this case for this patient, things were not A-okay. Once again, I don't know what led to that patient's passing, but it would likely have been safer if the anesthesiologist and the doctor and the primary care doctor all got together and were able to maybe have a lung doctor look at this patient, maybe identify the beginnings of pulmonary hypertension. Once again, I don't know, but common sense tells me that you should be speaking up for yourself and at least tell your doctor what other doctors you had spoken with. I would certainly appreciate that as a doctor. Number two, if you received a special type of test, like a stress test or maybe a lung test to look for how adequate your lungs are working, or even a CT or an MRI, you should ask your doctor, hey doctor, I got an XYZ test for my surgery. Do you see it? Did you get a chance to review it? Maybe it was a blood test. Maybe it was an EKG. But if I don't have it in front of me, certainly I'm going to ask my patient if I'm concerned, but I also want you to speak up so that their doctor knows what test you had. Because if you had the tests but no one can review them, it doesn't do you any good. Number three, if you're having surgery at an outpatient center, like in this case, if this was done in a hospital and she stopped breathing in the middle of the night, well, alarms would go off, kind of like when I connected myself to the monitor here earlier. For those of you who were here at the beginning, you could hear the beeping go off if the oxygen level goes too low. But if it's an outpatient surgery and you are being discharged directly home after the surgery, well, who's going to be monitoring? Even if you have a pulse oximeter, it's not the same as being monitored by nurses and doctors in a hospital. So I want you to feel comfortable saying to your surgeon, hey doctor, given my fill-in-the-blank condition, maybe sleep apnea, severe heart disease, or heck, it could be your hypertension or diabetes, doesn't matter. You don't know what the criteria is. Given my X, Y, and Z, is it safe for me to have surgery at an outpatient center? I want you to feel comfortable asking and speaking up for yourself, because in many cases it is. It's a 10-second question, but it will help you convey your concerns to your doctor, especially your anesthesiologist and surgeon, so that if it's safer for you to have the surgery in a hospital, maybe it's more inconvenient to you as the patient, but you know what's more inconvenient? Having to go at 3 in the morning and seeing your wife not breathing and having to call 911 and have to witness her pass away. So I'm not making fun of any of this here, but I just want you to know what to say to your doctors so that you can best advocate for yourself. I don't think anyone else will tell you. I feel like you should know. I want to answer your questions. Just as a reminder, if you learned something new, please remember those 3 things that I shared. Share them with your loved ones, whether they're having surgery or not, any type of medical procedure. And you can always hit that like button and subscribe to keep up with all of my content. For those who are a member, thank you so much for supporting this work. I get to see your questions and answer them preferentially now because they blip up here on my screen. But otherwise, I hope that everyone here feels comfortable speaking up for themselves in the broken medical system that we work in. Courtney, thank you so much for the kind comments. No true flags. Doctors don't have time to review stuff. I don't think you can say that for all doctors, but I think that if you can speak up to let them know what tests you had done, well, it was your body. Hopefully you know it was done. And if you don't, which is understandable because there's a lot of fancy tests out there, at least feel comfortable saying, hey, I got a test. I saw this specialist. Do you see their note? So that I don't have to be guessing about your life, or not me, but your doctor before surgery about, oh, maybe they had this test done, maybe they didn't. Because that'll give you a better outcome in the long run. Candy, do you go under general anesthesia for breast biopsy? Typically not. Typically not. Thank you. This may pertain to me. Well, Queen of Sheba practitioner, I hope that you are feeling more comfortable speaking up with your doctors, especially before surgery. Jody, so good to see you. And Judy, hello back from California. Kathleen, I've gotten much better at advocating for myself from watching your videos. Awesome, thank you so much. I've been able to get off many medications that I do not need. Well, what else could I ask for? What else could I ask for you to come off of your medications? Stephen sent me a note up here, and Stephen, I gotta say, after 3 years, I'm finally working on my book of how patients should speak with their doctors, and no small thanks to your encouragement. So thank you, Stephen. I really appreciate it. Hey, good to see you, Malia, and thank you so much for being a member. I can see your questions more easily. And Sherry, hey, thank you as well. Malia, I believe you're having surgery soon. I'm wishing you the best for your surgery. And oh my gosh, that's so kind, Sherry. You gifted 5 more memberships. Very, very kind of you. Wolf, good to see you. And all right, let's get back to our questions. So many here I'm trying to keep up with. I do have a question, but it's a few sub-questions to it. How do I get your thoughts? David, I don't know if that's a complex question. Maybe if you join one of our private lives that happen once every couple months, you can ask them there. I'm very curious what it is now. Tea Leaf, I'm having 360 lipo sculpting. How safe is that? Well, Tea Leaf, it's typically very safe. Depending on your medical conditions, the risk might vary, but typically it's a safe procedure. You're going to be often flipped 180 degrees so the surgeon can also lipo on your back flank area as well. So you might wake up with some swelling in your face when you wake up, and that's okay. That's not nothing to be concerned about. Hey, Stephen, I might well ask for your thoughts on the first edition or on the first revision when it's done. Thank you. Avalon woke up during surgery, fought the nurse, ripped out the eye bandages, and ended up scratching my corneas. Avalon, this is a really serious condition, what we call corneal abrasions, that are often avoidable, though in cases like this, it just demonstrates how important it is for the anesthesia dosing to be appropriate. And there's many considerations. I have lots of videos on how we dose the anesthesia to help minimize that risk that you're sharing, while also not overdosing the patient as well, because anesthesia is constantly a balance. I wasn't there. Obviously, what happened was not good, but I hope that you're able to share what happened with any future doctors to minimize the risk of that happening again. Maybe we could figure out why that happened. Does this also stand for a colonoscopy? By and large, colonoscopies have such mild anesthesia requirements, and you don't have surgery around the delicate parts of your face, that the risk is typically much, much less for routine colonoscopies. Tammy is having a gastric sleeve surgery. How safe is it? Just like the previous question, often very safe, but there are certain conditions that people might have having a sleeve gastrectomy. I don't know your medical history, Tammy, but certainly sleep apnea would be a concern, as well as the risk of reflux or any other types of conditions around the type of surgery, as well as the risk of sensitivity to opioids and pain medications. Vicky, I've had 3 surgeries for reverse shoulder. The doctor says I have severe atrophy. Can I reverse muscle at 69? Can you have a reverse shoulder? I've certainly had patients in that age range go through a reverse shoulder arthroplasty without complication. Believe it or not, Vicky, it depends on your protoplasm. That's a good word that most patients have never heard. The protoplasm is kind of what you bring to the surgery in terms of your nutrition status, your cognitive status, and your physical fitness, because all of those go in to determining how you go under anesthesia and tolerate the surgery, but more importantly, how you recover after. And there's a ton of information that you should be aware of for what we call prehabilitation, so you optimize your body before surgery. Are you familiar with what I'm sharing? Let me know in the comments. Stephen, can colonoscopy be done without anesthesia? Absolutely. It's just very, very uncomfortable, but it can be done. It can be done. Tea Leaf, thank you for being a member. I just had facial feminization surgery 6 months ago. I still have swelling, so I won't notice. Well, I hear you. I hope that it is becoming less and less painful over time, though. Hey, M. Henderson, thank you for the kind comments and the support. Rosetta, why does some meds react differently in people with autism? Rosetta, I have a whole video coming up on genetics in just a little bit. where genes that are more common in certain racial groups can impact how we respond to anesthesia to a degree, as well as some genes that are not segregated by certain racial groups. There's patients with red hair who might respond differently. Now, autism has many different associated genetic polymorphisms. I'm not aware of any specific genetic changes that influence anesthesia for all patients with autism, but certainly I've had some patients in whom, when I review their genetics, there are some variants that are known to interact with anesthesia medication. So it's a very deep topic I'm happy to talk more about later on. How can I join and would feel better? No, well, David, it's very kind. I appreciate it. You can always visit my clinic's website to learn more specifically, or join on YouTube. It looks like you're coming from Facebook, but there is a group on YouTube where you can ask those questions. My clinic's website is claris-health.com, and you can always reach out there to join our community webinars. Why are doctors so scared to treat chronic pain patients, James? Because they are afraid of the legal landscape around them. I have a whole video on this. It's really, really unfair to patients. Surgery risk with POTS and Ehlers-Danlos? Absolutely. The risk of autonomic instability and potentially worse pain after surgery, because you may already be on some pain meds prior to surgery. And if the right doses aren't given after surgery, that might lead to acute exacerbation of your pre-existing chronic pain. If you tell your anesthesiologist, they should have the tools. Just sitting in hospital waiting to go in for first-time surgery, going to be a long one. Tongue cancer, watching your videos is so calming. Brad, I hope everyone here can take a minute and just recognize what you're going through and send you, if you will, positive healing vibes, positive healing energy, or just warm thoughts. There are so many folks like you, Brad, out there, and a lot of times in hospitals, this is like our everyday job, just, pushing propofol, that sometimes the staff might not be aware of what's going on within your body. And realistically, it might be hard for them to appreciate what you're going through because it's what they live every day, day in, day out. But everyone here, I'm sure, is sending you positive energy. In fact, I'm looking at the comments coming in here for you, Brad. You're certainly not alone, and I'm really wishing you the best. And my goodness, you have a lot of fantastic folks out here who are wishing you the best. I just want to say that you guys are so incredible out here, giving Brad so much positive. Nothing more to say, Brad. Look at how many folks out here are wishing you the best, myself included. I'm really hoping that you have a successful tongue surgery. I know it's not easy. There's probably other parts of your mouth that are going to be affected as well. No one's a stranger to that. I'm not saying I believe in non-locality necessarily being an underpinning of medicine, but I think that it's pretty human to address that and recognize it, and I'm sure others would appreciate that as well.